Welcome to the deep dive. Today, we're looking at something really crucial for long-term health, but maybe not always top of mind, cardiovascular health. And not just later in life, but starting much earlier. It's about building that foundation, especially if you're, say, under 30, or maybe you're a parent thinking about your kids.
Absolutely. And we know you, our listener, want the key info fast and clear.
Yeah.
So we've dug into some really insightful stuff today.
Yeah, we've looked at blogs from the Surrey Cardiovascular Clinic. They focus a lot on prevention across different ages, and also the NHS England guidance on something called familial hypercholesterolemia, or FH.
That's right.
So our mission is simple. Get to the heart of why thinking about your heart health early matters so much. We'll look at family history, especially FH, and this growing concern about metabolic issues in younger people.
Okay, so where do we start?
Yeah.
It does feel a bit strange talking heart disease when you feel young and healthy.
It does, yeah. But the processes that lead to cardiovascular disease, they often kick off way earlier than people think.
Decades earlier, sometimes. Yeah, before any symptoms even show up. I mean, by the time someone actually has, say, a heart attack, the underlying problems have likely been brewing silently for a long time.
Decades. Wow. So it's not like it just appears out of nowhere when you hit 60.
Not at all. The evidence now really points to this idea of lifetime exposure to LDL cholesterol, that's the so-called bad cholesterol, and also high glucose variability.
High glucose variability. What's that exactly?
Think of it as big swings in your blood sugar during the day. Even if your average level seems okay, these sort of repeated spikes and dips put stress on your blood vessels.
Okay.
And both of those things, lifelong LDL exposure and glucose variability, they're now seen as really strong predictors of future risk. Studies have even found fatty streaks, like the very first signs of artery damage, in kids and young adults.
That really changes how you think about it, doesn't it? It's not just an older person's issue.
Exactly. The traditional approach often focuses on people over, say, 40 or 50, using 10-year risk scores. And those are useful tools, don't get me wrong, for population health. But they can miss younger people who are already accumulating risk factors. Factors that really could and probably should be tackled much sooner. For a lot of people, the best window for prevention might be closing by the time those calculators even come into play.
Right. So if we want to be proactive, what should we focus on? What are those things we can actually, do something about?
Yeah, the modifiable risk factors. Things you can influence. Top of the list are often raised. LDL cholesterol and high blood pressure. Smoking is still a massive one.
So huge, yeah.
Definitely. Then there's things like mental health or socioeconomic factors, which can really impact lifestyle choices. Inflammation in the body plays a role. Even untreated viral stuff like HIV. And then the more, perhaps commonly known ones. Being overweight or obese, waist-to-height ratio is often a better measure there. A poor diet, especially high in saturated fats and those processed carbs we hear so much about, and not getting enough physical activity.
That's quite a list.
And there's also raised LPA, lipoprotein little a. It's another cholesterol-like particle, mostly genetic, and high levels are a risk factor on their own. And finally, type 2 diabetes or insulin resistance. They're big contributors too.
And you mentioned these things add up over time, like a cumulative effect.
Absolutely. The longer your body's dealing with high LDL or high blood pressure or obesity or the effects of smoking, the more potential damage builds up in those artery walls. So the earlier you can spot and manage these things, the better your chances of heading off serious problems later.
So for listeners under 30, things like not smoking, keeping a healthy weight, watching the processed carbs, that can make a real difference down the line.
A massive difference to your long-term cardiovascular path, yes.
Okay, let's shift to family history. You mentioned that's a big indicator. How does what happened to our parents or siblings affect our risk?
It's a really powerful clue, actually. It tells us about your potential genetic predispositions, regardless of how healthy your lifestyle might seem right now. It can really guide how early and how seriously you need to think about prevention.
So doctors ask about this specifically.
Okay, yes. Cardiologists will definitely ask.
Yeah.
They want to know if your first three relatives, so parents, siblings, children, had a heart attack or needed stents or bypass surgery before they hit 60.
Okay. Under 60 is the key age there.
Generally, yeah, for defining early onset in this context. They'll also ask about early stroke, high blood pressure, AFib, aortic aneurysms in close relatives. And critically, has anyone in the family been diagnosed with that condition we mentioned, familial hypercholesterolemia or FH?
Right.
Or did relatives start statins, those cholesterol drugs, really young? Or have they been told they have high LPA? Because standard tests don't always check LPA, family history is often how it comes up.
So a pattern of early heart problems in the family is a definite red flag.
It is. It suggests you might have a higher baseline risk, probably due to genetics, that's sort of separate from your lifestyle choices right now. It usually means earlier screening and more proactive prevention is a good idea.
It's that kind of nature versus nurture thing again?
Pretty much. You can think of it roughly as maybe 50% of your risk comes from your genes and the other 50% from your lifestyle and environment.
Okay. Let's talk more about FH, familial hypercholesterolemia. You said it's particularly significant for early risk. What exactly is it?
So FH is a genetic condition. It directly affects how your body clears cholesterol, specifically LDL cholesterol. People with FH just can't remove LDL from their blood effectively because of a gene defect.
Okay.
This means they have really high LDL levels right from birth, and that drastically increases their risk of getting heart disease much, much earlier than average.
High LDL from birth. Wow. How common is FH?
It's actually more common than you might think. About 1 in 250 people have it.
1 in 250. That's quite a lot.
It is. But here's the really concerning part. In the UK, it's estimated that fewer than 8% of people who actually have FH have been diagnosed.
Less than 8%. Why so low?
Well, awareness is a big part of it. And high cholesterol itself doesn't usually cause symptoms, not until something major like a heart attack happens. So unless it's specifically looked for, especially in families with a history, it gets missed.
That feels like a huge gap in prevention. What happens if FH isn't diagnosed and treated?
The risks are really significant. Untreated, men with FH have about a 50% chance of a heart attack by age 50. For women, it's around a 30% risk by age 60.
That's incredibly high.
It is. And what's more, studies show that children with FH can already have signs of thickened arteries by age 11. The atherosclerosis process, that plaque buildup, starts really, really early for them.
So how do doctors diagnose it? What are the clues?
In the UK, they often use something called the Simon-Broom criteria. Generally, it involves finding very high LDL cholesterol. Usually the threshold is over 4.9 millimoles per liter, which is about 190 milligrams per deciliter.
Okay, 4.9 millimole or 190 milli-GDL.
Right. And you also need either a family history of early heart disease or similarly high cholesterol in relatives, or a definite diagnosis can come from physical signs like tendinopathy. Those are cholesterol deposits you can sometimes see or feel on tendons.
Like little lumps.
Yeah, often on knuckles, elbows, knees, or the Achilles tendon. Or the gold standard is a genetic test confirming an FH-causing mutation. Just remember that guideline. LDL over 4.9 or 190 plus that family history definitely warrants investigation for FH.
And if someone is diagnosed, what about their family?
That's where cascade testing comes in. It's crucial. Because it's genetic, each first-degree relative parent, siblings, kids has a 50-50 chance of having inherited the same gene mutation.
Right.
So cascade testing means proactively offering testing to those relatives. It's a really effective way to find other people in the family who have FH and could benefit from early treatment.
And what does that treatment usually look like for FH?
Statins are the main treatment. They're very effective at lowering LDL. And starting statins young, if you have FH, can make a massive difference. If it's started early enough before significant heart damage occurs, it can basically normalize life expectancy for many people with FH.
Normalize it? That's amazing.
It is. But there's a key point. If someone with FH already has heart disease before they start treatment, even with statins, their future risk unfortunately stays higher than the general population. Early detection is everything.
Are there other treatments besides statins?
Yes. For some people who don't get their LDL low enough with statins or can't tolerate them, there are newer drugs called PCSK9 inhibitors. They're very powerful LDL-lowering agents.
Okay.
And of course, lifestyle is still vital for everyone with FH. A heart-healthy diet, not smoking those, are just as important alongside the medication.
It really drives home that early detection point.
Absolutely. The official UK NICE guidelines actually recommend identifying children with FH before age 10 so intervention can start early.
Yeah.
That early action can completely change their long-term health trajectory.
Okay, let's circle back to LDL targets. You mentioned over 4.9 millimole or 190 milli-GDL with family history could mean FH. What are the sort of ideal targets for most adults, and how do they differ for someone with FH?
Right, so for people with FH, because their LDL has been high since birth, their targets are generally set even lower than for the general population.
Yeah.
We really want to minimize that lifetime exposure.
Okay.
But for most adults, say in their 20s or 30s without FH, an optimal LDL level is generally considered below 2.58 millimoles per liter. That's 100 milligrams per deciliter.
Below 2.58 or 100. Got it.
Yeah. Then you have ranges like near optimal, which is about 2.58 to 3.3 millimole, or 100 to 129 milli-DDL. And borderline high is around 3.3 to 4.1 millimole, or 130 to 159 milli-GL.
So even those borderline levels are worth paying attention to.
Definitely. The overall principle is pretty clear from the science. The lower your LDL is, and crucially, the earlier in life you can get it lower and keep it there, the lower your future cardiovascular risk will be.
Lower and earlier. Simple message, but powerful. Now, the sources also really highlighted metabolic issues and carbohydrates impacting younger adults, 20s and 30s. What's the concern there?
This is a really growing area of focus. Poor diet, especially diets high in processed, high glycemic carbs, think sugary drinks, white bread, processed snacks, is a major modifiable risk factor even for younger folks.
Right.
We're seeing this global trend linking these kinds of carbs to more metabolic stress, rising obesity, and even type 2 diabetes showing up earlier, like in the 20s and 30s.
So it's not just about saturated fat anymore. Carbs are a big part of the picture for heart health, too.
Exactly. While fat intake, especially saturated and trans fats, still matters hugely, the impact of these high-carb diets on blood sugar control and overall metabolic health is becoming much clearer. And what's really interesting
Go on.
is that many people in their 20s and 30s might have a normal HbA1c test. That's the test that gives you an average blood sugar over a few months.
Yeah, I've heard of that one.
But even with a normal HbA1c, they can still have these really big unhealthy spikes in glucose right after eating high glycemic foods. These spikes aren't captured by the average, but you can see them with things like continuous glucose monitors, CGMs, or specific tests like the TAR-bar test.
Wow, so your average can look fine, but you're still having these potentially damaging sugar spikes.
Precisely, which is why thinking about getting a lipid profile, checking your cholesterol even in your 20s, isn't a bad idea, especially if heart disease or diabetes runs in your family. Building those healthy habits early is just so key.
So what practical lifestyle advice comes out of this for people in that 20-30 age bracket?
Well, the basics are fundamental. Number one, avoid smoking. Full stop. Then, know your numbers, cholesterol, LDL, BMI, maybe waist-to-height ratio.
Okay.
Diet-wise, focus on cutting back saturated fat, choose lower glycemic foods, think whole grains, veg, legumes, use healthy unsaturated fats. Really limit the processed snacks and sugary stuff. Some evidence suggests plant sterols might help too.
Right.
And physical activity. Really aim for maybe 60 minutes most days or get those 10,000 steps in. Plus, don't forget sleep and managing stress. They genuinely impact heart health.
Any specific food swaps you'd suggest?
Yeah, simple things can help. Maybe ditch the sugary breakfast cereal or white toast for eggs, plain yogurt with berries, or oats. Avoid the regular fast food runs. Try to follow something like the Harvard Healthy Eating Plate model. Lots of plants, lean protein, healthy fats.
Makes sense.
And as we mentioned, some people find using a CGM for a short time really eye-opening to see how their body responds to different foods. Oh, and some research explores intermittent fasting, but definitely talk to a doctor before major diet changes. Really, it's about setting up your environment, home, work, uni to make the healthy choice the easy choice.
This has been incredibly insightful. The main takeaway really seems to be, don't wait until you're older to think about your heart.
Exactly. Early prevention benefits everyone, but it's especially vital if you know you have that family history of early heart disease, or if FH is a possibility. Taking steps in your 20s and 30s can genuinely change your future health.
So as we wrap up, what's one final thought for our listeners to chew on?
I just encourage you to really think about your own situation. What's your family history like? What are your current habits? Taking proactive steps for your cardiovascular health isn't just about living longer, It's really about adding life to your years, making sure those years are healthy and active.
Adding life to your years. I like that. A great place to end. If you do want to delve deeper, check out the resources we mentioned, the Surrey Cardiovascular Clinic blogs, the NHS England FH info links will be in the show notes. Thanks so much for joining us for this deep dive.